I often see patients in OPD who went for a routine health checkup and then ultrasound said that they had a gallbladder polyp. Most of them are very scared after that diagnosis and they think that they have, some tumor or cancer in gallbladder and they immediately need treatment. Most of these gallbladder polyps are harmless. They are pseudopolyps, but some of them are not, and you need to know which one of them are not harmless. 90% of these polyps are pseudopolyps or false polyps. They are just deposits of cholesterol on the gallbladder wall and they do not turn into cancerous, they don't increase in size, and we need not do anything about them apart from just regularly following them up for any change or for an increase in size. But a small proportion of these polyps are true polyps. They are adenoma. They are either cancerous or has the potential to turn into cancer. And these are the polyps which need treatment. They need surgery to remove their gallbladder with a specific method. How do we detect? How do we know that which gallbladder polyps are cancerous or has the potential to turn into cancer? We look at many things. One of the most important thing is size. Whether it is less than 5 millimeter, 5 to 10 millimeter or more than 10 millimeter. We are specifically worried about the polyps which are more than 10 millimeter. Apart from that, we also look at the age of the patient. We look at ethnicity of the patient. For an example, Indians are at a higher risk of cancer and we lower the threshold of surgery for them. Then if they have stones along with that, if it is a solitary polyp, solitary means something which is only one polyp. If it is a flat polyp, sessile we call it, or if it is associated with gallbladder wall thickening or invasion into the liver bed. These are the signs which tell us that this polyp might not be innocuous and might hide something more sinister. And these are the patients whom we advise to undergo surgery. Now when we talk about surgery for these gallbladder polyps, we have to understand that this is not a routine simple cholecystectomy for gallstone as it is usually done. We call it simple cholecystectomy. When we do surgery for these suspected polyps which have potential to be cancerous, we remove the gallbladder in a particular way where we take a small wedge of liver along with that. We call it anticipatory extended cholecystectomy or cystic plate cholecystectomy, and we do these procedures with a laparoscopic or robotic technique. When we remove the gallbladder with this particular technique, we ensure that the tumor, if there is one, doesn't spill and doesn't increase and there is a proper oncological resection. Then we send that gallbladder for frozen section. Frozen section is something which will give us the pathology report within 20 minutes to half an hour and it will tell us whether it is cancerous or not, and then we proceed accordingly. So if you have been detected with gallbladder polyp, don't worry. Most of these are innocuous, but some of them are not, and you should see a GI-HPB surgical oncologist to decide which gallbladder polyps need surgery and which one can be observed and how to operate them. Detect early, treat right, save lives.